Alcohol abuse. A person starts abusing alcohol or drug mostly during adolescence. Now, what is adolescence? Adolescence is a period as well as a process of a child becoming mature due to development of his or her own beliefs and trusts. So, in simple words, adolescence is the bridge between adulthood and childhood, and the time period is 12 to 18 years of age, which is considered as adolescence. Now, what is the relationship between adolescence and alcohol abuse? Why I'm saying that a person starts alcohol abuse or a person becomes alcohol abuser mostly during adolescence. Why? Because curiosity, need for adventure and excitement. Also experimentation. These are the common causes which motivates or stimulates an adolescent towards drug as well as alcohol abuse. I repeat, curiosity, need for adventure and excitement, as well as need for experimentation. These are the common causes which stimulates or motivates an adolescent towards drug or alcohol abuse. Now, what is addiction? Definition of addiction. It is a physiological, psychological attachment to certain effects. Those are euphoria and temporary feeling of well-being. These are associated with drugs and alcohol abuse. So, in simple words, when a person starts repeated using of alcohol or drug, he feels joyful as well as happy, and he feels, I'm very good, there is no problem in my life. This psychological attachment or these effects are due to use of alcohol or drugs. This is called addiction. Now, when a person becomes addicted to drug or alcohol, he can in the beginning he can understand that it is he or she can understand that it is harming his physical as well as mental physiological condition. I repeat, when a person starts abusing alcohol or drug, initially that person can feel deterioration in his mental, physical as well as psychological state. Still, he cannot get rid of or still he continues to, or just to get rid of that feeling, he increases the dose of drug or alcohol. This leads to dependence. Now, what is dependence? It is the tendency of the body to manifest a characteristic and unpleasant withdrawal syndrome if regular dose of drugs or alcohol is abruptly discontinued. Now, if a person thinks that I want to quit drug or alcohol, suddenly he thinks and he suddenly stops using the dose of drug or alcohol, then his or her body will show certain symptoms which are very unpleasant, and it is cyclic kind of a thing. That's why it's called withdrawal syndrome. Now, what are these symptoms? Anxiety, nausea, shakiness as well as sweating. Now coming to the effects What are the effects of alcohol or drug abuse? Immediate adverse effects include reckless behavior, vandalism, and violence. And excessive use can lead to coma and death due to respiratory failure. Now coming to the common warning signs. Means what are the signs to understand a person is abusing drug or alcohol? Those are getting low marks, that is drop in academic performance, unexplained absence from school or college without prior notice, student starts not coming to school, lack of interest in personal hygiene, a person do not maintain his or her personal hygiene, then withdrawal, isolation, depression, fatigue, aggressive and rebellious behavior, deteriorating relationship with family and friends, loss of interest in hobbies, change in sleeping and eating habits, fluctuation in weight and appetite, etc. So these are the common warning signs of alcohol or drug abuse. Now coming to the control. Now what all are the adverse? Means a person can die. The alcohol effects can include death. Why? Because a person can develop AIDS or hepatitis B, which are ultimately fatal. How a person can develop? Due to taking intravenous drug. Drug is taken intravenously using the same needle and syringe by many people. That can lead to a drug abuser can easily develop AIDS or hepatitis B. And long-term effects of alcohol abuse include cirrhosis, that is disease of liver, and permanent damage of nervous system. Now coming to the side effects related to drug abuse by sports person. Why they get involved in drug abuse? To increase muscle strength and bulk and to promote aggressiveness so that their athletic performance becomes better. And in simple words, the effect includes masculinization of a female, and a male develops features like female. For example, masculinization include increased aggressiveness, mood swings, depression, abnormal menstrual cycles, excessive hair growth on face and body, enlargement of clitoris, deepening of voice, etc. In case of male, acne, increased aggressiveness, mood swings, depression, reduction of size of testicles, decreased sperm production, potential for kidney and liver dysfunction, breast enlargement, premature baldness, enlargement of the prostate gland, etc. As I told in simple terms, masculinization of female, and in case of male, few female-like characteristics, that is feminine characteristics, are developed. Now coming to prevention and control of alcohol or drug abuse. Main methods are avoid undue peer pressure. Second point, education and counseling. Third point, seeking help from parents and peers. Fourth point, looking for danger signs. This is for parents and teachers. And the final point, that is seeking professional and medical help. Now coming to avoid peer pressure. Undue peer pressure. A child has his or her own choice and personality. Suppose a child prefer dancing. So don't force the child for singing. So each and every child, and moreover, each and every child may not be very good in either in studies or extracurricular activity. So a parent must not force their child for either for education or means for better result or to be first in the class or for extracurricular activities. Now coming to education and counseling. A child must be properly educated as well as counseled, that his or her life will be full of stresses and problems. Everybody have to deal with their own problems and stresses. That doesn't mean a person will take help, will become a drug or alcohol abuser. So it's better to channelize any child towards sports, reading, music, yoga or any other extracurricular activity. But I repeat, they must not be forced. Now seeking help from parents and peers. If a person is becoming drug abuser or he or she just started, then he or she must seek help from parents and peers so that he can that person can get rid of the problem very easily. And also to handle pressure or to flush out the feelings of anxiety and guilt, a person must seek help from parents as well as his or her friends, close and trusted ones. Now looking for danger signs. These are for parents as well as teachers. I explain the danger signs, that is reckless behavior, rebellious behavior, violence, vandalism, then change in sleeping, eating habits, low academic performance, absence from school or college without prior notice, withdrawal, isolation, misbehaving, etc., etc. These are the common warning signs which a parent as well as parents as well as teachers must pay attention. If a child or student is showing these symptoms, then proper help must be taken. How to take? Professional and medical help can get rid of the problem. Who will give these helps? Highly qualified psychologists, psychiatrists, de-addiction and rehabilitation programs help each and every individual to get rid of drug or alcohol abuse. Along with that, sufficient effort, will power from that person also required.